Thank you, Sunny, and thank you, everybody. So, yeah, I'm Ainslea. I'm a health psychologist. I've recently joined Lincolnshire Partnership Foundation Trust as a practitioner health psychologist. I also have a research role at the University of Leicester too. So today I'm going to bring you some experiences, my reflections, and also some tools and guidance to kind of navigate working in psychology and physical healthcare. So today I'm going to talk to you about these themes. So we're going to unpick some of the things that are driving the scale of demand for psychology and physical healthcare. I'm also going to talk to you about the role of using research in practice. There's a lot of academic research. Not all of it gets used in practice, so there's a bit real gap there. So I'm going to talk to you about my experience of plugging that gap. Digital transformation, it's coming, it's here. So, you know, what is the potential role in physical healthcare and how can we perhaps navigate that? And I'll also share with you some of the digital health projects that I've been involved in. And I'm also going to talk to you about the workforce. So the rest of it, broadly, let's talk about physical healthcare and psychology. For this bit, I'm actually going to focus on the issues for health psychologists. There's a lot of barriers there, so I'm just going to talk to you about some of the projects that have kind of helped to create opportunities for health psychologists and the ongoing training. So the scale of demand, let's start with that. Some of the driving factors. So we've now got an ageing population, and with that, we've got this healthy ageing agenda. You know, what is ageing well? What does that look like? How can we support people? There's also a whole industry around wellness these days. So that's driving some of the demand for healthcare because people are more involved in their health. You know, there's more solutions out there. We've also got a rising long-term conditions and multimorbidity. When the major conditions strategy came out, I was absolutely struck that 1 in 4 people are now living with 2 health conditions. That's huge. So we're seeing this rise in not only people living with long-term conditions, but also complexity around combining physical conditions, mental health conditions. The people that we're working with, it's getting more complicated. We're also seeing a rise in health inequalities, and there's a range of factors that are also driving who's able to access high-quality care and how we also deliver high-quality care for a range of different patients and people and clients and service users. And also technology is more rapidly available. A lot of us using wearables. So I'm loaded up with technology. I absolutely love it. Other people, it's their worst nightmare. But actually, we're that first generation that can spot when we're getting ill or signs of illness. And there's also apps that can help plug that gap for healthcare. There's a lot more information out there, you know, variable quality, but it's there. So all of these things are driving the demand for physical healthcare and psychology. So some of the NHS responses, so as I just alluded to, there's the major conditions strategy, and we mentioned this a little bit today. It's that focus on prevention and early diagnosis. And we also mentioned that, yes, there's perhaps a workforce and training issue there. Health psychologists, a huge part of our training is staying well, you know, living well, being healthy, wellness, and what that looks like, as well as the kind of response to ill health. That said, healthcare services are under a lot of unprecedented demand. So how do we manage the prevention and early diagnosis agenda on top of, you know, already quite stretched resources? We've also got this there's a lot of digital capability that is going to help us do some of our work faster or more efficiently, or at least that's coming. Again, there may be like a skills gap for some of us who are less used to working with digital technologies. And I'm going to speak a little bit about the solutions on that later. Personalised care. So moving towards less on that, I should say, less on the kind of reactive side, more on prevention. So being able to kind of take a whole systems approach to people's needs, not just in crisis moment, but, you know, also thinking about prevention and really challenging some of what's driving the health inequalities. But ultimately our goal is to work out how we can deliver the right care to the right patient at the right time. That's ultimately our goal. And I'm going to talk a bit about the example of cancer. So it's particularly important because we've seen huge demand for psychology in cancer care. And as a response, Macmillan have actually funded a lot of psychologist posts, including my own, and also services to help plug that gap. They've also been involved in commissioning training to healthcare professionals so that they can deliver psychologically informed care as well, so that it's more prevalent. And the thing about cancer care is there's so many different areas in the care trajectory where we can respond as psychologists. But also, this is just to highlight that the patient's needs are different at each stage. Having those concerns about health, and do you actually reach out? Going for the tests and the kind of anxiety that can throw up. But then actually having that diagnosis, going through treatment, these all, we have different psychological needs at all of these different stages. So the Macmillan service is around making sure, again, the patient receives the right kind of treatment at the right time, depending on that, where they are in the treatment trajectory. So as I said, I've recently joined Lincolnshire Partnership Foundation Trust, and we've been funded by Macmillan. And the work that we're doing, we've recently been scoping out the kind of needs and needs assessment of what needs doing to expand the service. So we actually launch on Monday, so really exciting time. And we're going to be delivering care in the community, so video therapy as well as face-to-face for people going through treatment, or even after treatment as well, and also eventually extending that to friends and family members of anybody affected by cancer. We're also going out to the wards to meet the staff and kind of understand how we're going to work with patients whilst they're in hospital having treatment. We also understand that people that are delivering the cancer care, healthcare professionals, also have needs as well. So we're going to be, a huge part of our role is going to be supporting them too, as well as providing supervision and training for healthcare professionals so that they can deliver some psychological informed care too. So part of the scoping work has been also looking at a seamless offer across the county to find out what support is already available and how can we utilise that and weave that into the cancer care trajectory. Part of my work has also been looking at digital resources. So, Macmillan in particular offers sleep and CBT apps, but also we use digital resources, psychoeducation and apps as part of our therapeutic work. So how we weave that in there as well, and building up a bit of a digital repository. Okay, moving on. So thinking about the research and practice gap. So as I alluded to, there's a lot of research that goes on. And I actually work in both fields, so I kind of have a bit of perspective on this. And so the challenge is that, the research, there's lots of it. Not all of it is very practical, but it does help us understand potential, gaps or client needs. A lot of it is quite theoretical, so it's not always obvious how we kind of use it. A lot of it is done in the laboratory, so it's quite empirical. It's not always obvious if it's been co-created, has the service user had a voice in it? And quite often it's to do with, a lot of the research is driven by short-term funding, different trends that we see, responses to particular health issues that we see. As practitioners, we know how it goes. It's quite difficult keeping up to date. There's more journals than there's ever been, so there's articles coming out all the time. What's high quality? What do I need to be seeing? What do I need to be reading? Can't read all of it. And it's probably the one thing that gets squeezed in our day-to-day role. For some, it's a bit of a side passion, and it's not always necessarily relevant to the patient care. And there's few frameworks out there or kind of like guidance around how we actually would use research in practice. So how we actually take an intervention and then kind of roll it out for our patients or make those adaptations so that we actually could use it. So it's a real shame because there's so much out there, and we need to know how to use it. Again, trust. So reflecting on a conference that I attended recently, publication conferences, they're very much about outcomes, like we found this and it was significant, or here's my key messages. And actually, we're really interested as practitioners in how was that intervention developed? How was it rolled out? Was there any kind of like implementation issues that we should know about? Yeah, so we've got all these things that we need to bring together. So I've actually been involved in a lot of projects in the European Health Psychology Society to kind of address this. At the conference and other events, we've done roundtables, we've invited healthcare professionals in to kind of ask, how do you use evidence? What is useful to you? I was quite often the sole practitioner psychologist there amongst a whole load of healthcare, health psychology researchers, but it was really uniting those two agendas, like, you've got skills, we've got skills, how do we work together? What are the most critical research questions that you should be focusing on? How can we get it all out there? So we've written some position papers. We also do stakeholder grants, so the healthcare professionals can attend our conference and kind of see what research is out there, but also help drive and inform some of the questions that they're generating. The other project that I'm going to talk to you about is the Practical Health Psychology blog. So I'm the head editor, one of the head editors for this. And just Google it, Practical Health Psychology blog, it'll come straight up. And what we do is we look for cutting edge health psychology research that could be translated into practice. And it's aimed at healthcare professionals. So it's a summary of the research and some practical findings. And it's then translated into 25 different languages across Europe and the world, I believe, and disseminated into 30 countries by our national editors as well. So, yeah, it has about 100,000 views a year. So go check it out. It is free. It's funded by the EHPS, as I say. There's also a link to download our blog. We put it all, our book. We put volume 1 into a book, which you can download for free, as I say, and also order hard copies. And I just wanted to show you an example of one of the posts. So one of the most popular topics was how to maintain long-term health behaviour change. So my colleague summarised her research on this, and then some practical recommendations at the end. So it's a super simple, elegant way of kind of getting research out into practice. Give us ideas of other topics that you would like to see on there. We're always open to doing that. We aim to publish about 1 article a month, so it's an ongoing thing. Okay, digital transformation. So I just wanted to highlight a couple of key areas of growth in terms of digital transformation and innovation. So we've got genomics, which is kind of looking at more accurate diagnoses with a genetic basis and kind of precision medicine. So it allows patients to know their likelihood of developing one of these diseases. That has all sorts of psychological implications, doesn't it? Digital medicine. So you're probably most familiar with like telemedicine, telephone triage, 111, video appointments. That became huge in the pandemic era. Smartphone apps and digital therapeutics. So they're quite useful for self-managing conditions, using techniques. Basically, a whole load of psychological support that you can access outside the clinical room. You know, for people that absolutely don't want to go anywhere near a hospital, thank you very much, because they're already there for, several appointments. Or it's quite useful for learning or practicing skills between sessions. Remote monitoring is another kind of area of growth as well. Check out the Radar CNS project if you haven't. So they've been doing remote monitoring of depression using wearables. Really interesting project based in King's College London. AI-based technologies, using automated image interpretation for faster recognition of ill health. Probably the one that's most relevant to psychological care, so that automated personalised psychological support, and speech recognition, other AI stuff to digitally enable and speed up the work that we kind of do and automate some of it. So they're the kind of areas of digital growth. So I'll talk about my role again. So as I say, we've been putting together a digital repository of self-management materials, psychoeducation, different apps that we can use that we can kind of seamlessly weave into the patient journey. And again, we're constantly collecting client feedback and service evaluation to kind of see who does this seem to be working for, so right patient, right time, right intervention. And also developing some of our own. A lot of them are quite generic, aren't they? So sometimes it takes some tailoring to kind of, stage of cancer, the person and what have you. Alongside that, we're doing a systematic review on digital ACT interventions. So as I was saying, as a practitioner, psychologist, research gets squeezed. I love systematic reviews because you can kind of put them down and pick them up again. So we're looking at how people in other studies have utilised ACT processes in a kind of the digital arena, so what they've done, what's the format. Was it feasible? Was it acceptable to people? And is there any effectiveness data? But also what we really want to know is there any behaviour change techniques that promote user engagement? So we're using the behaviour change interventions ontology, the BCIO. So some of you might be familiar with the UCL's behaviour change taxonomy. This is the new version, which I've just been hearing about at the HPS conference last month. Fantastic. Google the BCIO. There's training, online training, which is really cool, which will give you the latest version of all the behaviour change techniques that they have and interventions that they have categorised. I think there's now around 200. But also the mechanisms of action. So, how do these things, what makes these behaviour change techniques more likely to work? So there's some really cool training that you can access for free on that. Okay, some other kind of terms in digital that are useful is co-creation. So involving service users, involving stakeholders. So I just wanted to highlight 3 terms that get used interchangeably but actually reflect slightly different processes. Co-creation, so that's where clients have input right from the beginning all the way to the end. Co-production, where service providers and clients work together to kind of, come up with a joint outcome. And co-development, where you're developing something new together with input from a whole range of stakeholders. So I wanted to highlight a digital project that I did in collaboration with a multidisciplinary research team, so geographers, physical activity, me as the psychologist, but mainly exercise scientists. We were funded by Cancer Research UK, yeah, that's a link to the paper, so people don't get cancer, families do. And we wanted to develop something physical activity-wise that might help support people at that time of diagnosis of cancer, but also, bringing in family and friends as well. So as a way to kind of generate support for themselves and think about that. So we use the steps of quality intervention development framework. So that's where you start by defining the problem and causes, working out what's modifiable, defining processes of change, delivering the intervention, testing it and adapting, and collecting evidence. So it's quite a useful hybrid research and practice framework to kind of follow. We interviewed people with breast or prostate cancer, their friends and families, a whole range of healthcare professionals, physical activity providers, and cancer and charity representatives as well, so that we're getting a really broad spectrum of kind of perspectives, opinions on how we might navigate such an intervention and design it. So we then sent our interview findings to a couple of intervention development groups from these stakeholders. So we talked about the interview themes. We then identified some intervention targets, developed a prototype, reviewed it, and then kind of refined it in that way. So it was kind of, you give back the data, you discuss it, and you start to weave a prototype together. So in terms of our intervention targets that we came up with, the timing of the intervention, there were some mixed views. Some people thought that's not the time, diagnosis is just too problematic or a difficult time. Others were like, absolutely, like let's get people to start thinking about coping mechanisms, thinking about social supports. So again, it's a personal preference. It's not a one-size-fits-all and not something that you would press on people, but it would be an option. The format of the intervention, so mixed again. Some wanted a social media based, others were like, no, we want kind of hard copies. So again, providing flexible options for people was key. The framing of the intervention was so important to not be judgmental, that it is not something that, to not get that message across that physical activity must be something that you're doing at this time. It was more that this is an option. So that absolute framing was so important. And this is why we really valued getting all of those different perspectives. And people really wanted reassurance on the kind of like safety of physical activity and having access to people that could kind of provide that reassurance. In types of physical activity, again, people wanted options other than sport, so it couldn't be badged as that kind of thing. And also, there was different preferences for individual or group participation. So we put together the altogether active prototyping. And this was the kind of decision tree for it. So it was agreed that charity sports centres and other settings would kind of like house the intervention that they could access. They would provide a leaflet giving, some high-level information about the benefits of physical activity, and that they would then, be able to choose whether they went ahead with accessing the information or not. But it was mostly that it would be a website, and that there would be some tailoring and personalisation according to what the person's preference was. So it would kind of individualise the kind of support or options according to what they wanted. So that right patient, right time, it had that kind of those options there for people. So yes, that's just to give you an overview of how we've developed that intervention. So I'll now just quickly talk about workforce and some of the issues in physical healthcare from a health psychology point of view. So as I alluded to, and I used to run a Masters in Health Psychology course, so I would hear all sorts of stories and very aware of some of the barriers to accessing health psychology training or even advancing. And the one key thing that I would hear quite a lot was that getting the opportunity for practical experience and working with qualified health psychologists to supervise was really, really difficult. There's fewer of us, what have you. So at the time of COVID, the Health Psychology Exchange came together, mostly through Twitter and social media. We then decided we were going to come together, we're going to do something, but we weren't sure what. It then became quite obvious that as a group of practitioner health psychologists, we wanted to reach out to NHS trusts to offer support to managers primarily about identifying and meeting the psychological needs of their staff at that time. What we then did as part of that was we developed the psychological needs assessment tool so that they had something to kind of check in with staff, to consider a whole range of different psychological needs of the staff. And then we published the research as well. But the reason I mention this is it was probably one of the most transformational things that we did with the Division of Health Psychology community at that time, that brought people together very quickly and had a lot of outputs. Just to also say that there's accessing funded training. So health psychology training is mostly self-funded. It's quite rare. So there's now a pilot by NHS England, as it's now transferred to. And they're piloting funded health psychology training for trainees in a small number of NHS trusts using the COM-B behaviour change model. So to help optimise the psychological workforce as well. So it's something that we're keeping an eye on as, a case study. So just to summarise, my take-home messages are that using evidence to understand drivers of change and health inequity are absolutely key. We need to embed co-creation and digital innovations. They've got that power to enhance the scale of delivery of psychology in physical healthcare settings. Collaborative working is key, so not just multidisciplinary, but we've also got to think about utilising academic and research resources. Training and CPD need to be driven by clear standards and guidance, and absolutely translating research into practice is one of those skills. But we also need flexible approaches about how we generate and share evidence, particularly when you're in a practitioner role. We collect loads of evidence, and it's not often thought of as interesting outside our trust or our service, and it absolutely is, because this is, you're doing the key psychological work that, you know, and it's worth sharing. So thank you so much.